Are you aware what year drug policy was moved from from justice to health?
I don't have that history, but I'm happy to ask officials.
2016. Can I ask how many deaths happened because of the opioid crisis in the first quarter of last year?
I'll ask my officials to answer that question in terms of statistics. Eric?
It's okay.
Yeah.
How many, when this entire file became moved to health in 2016, what were the total number of deaths by the opioid crisis?
Just answer, Stephen.
Okay. Well, the total numbers since 2016 to March 2023 is approximately 36,000.
That's not the question I asked. I appreciate your response. I'm asking the minister. Does she know how many deaths had happened? I think the answer is no. How about how many deaths occurred in the last year?
The number of total apparent opioid toxicity deaths in 2022, which is what we have the last total numbers for on an annual basis, was 7,483.
So we started
with an
at-
average of 21 a day.
We started at 2,800 in 2016 when this government, the NDP Liberals, moved policy from justice to health, and now have nearly 8,000, over 8,000 in the last year. Are you aware what impact the Safe Supply policy has had on the informal market for opioids?
I know that there are articles of anecdotal evidence, anecdotal discussions on what is out there in terms of Safer Supply, but Safer Supply, as it is currently distributed, is under a prescription model.
95% reduction in prices because of how the government drugs have flooded the black markets. You know, in Leslieville, your taxpayer-funded safe injection sites are offering up chocolate bars to kids for used needles. And your
Mr.
government
Chair, point of
announced
order.
$4.6 million.
Point of
Excuse
order.
me, point of order from Mr. Fisher.
Thank you. I'm very well aware that the Conservatives don't let facts get in the way of a good social media clip, but I would ask that the member please show respect to the minister.
I'll respond to that another time because I have nothing but the highest respect for the minister. I'm just trying to get a sense if she knows her files. Your government has earmarked another $4.6 million for streamlining authorizations for supervised consumption sites. How many more Leslievilles do you plan on building across Canada?
It's based on an application basis to Health Canada for safe consumption sites to be implemented. They have to meet a stringent set of guidelines and evaluations before opening. They also have to be able to show, in addition to federal funding, that they are able to continue.
There's an ambition to open up more of these safe injection sites.
We believe that harm reduction is a key component in our policy strategy
Harm
to address
to
substance
Canadians.
use and the opioid crisis.
Minister, if harm to Canadians has gone up to such an exponential, out-of-control crisis, where the government is providing safe supply to a black market that is reducing price and making these drugs more accessible to children, that there are going to be more of these sites near schools across Canada. How can you, not knowing all the facts, how can you even sit at the table and support this unsafe supply legislation, this culture of death with MAID, if you don't know the scale of the crisis?